Hey everybody, Ed Button here from the Ozark Radio Network and OzarkRadioNews.com in front of Ozarks Medical Center here off of Kentucky Avenue in West Plains. Today is Friday, March the 2nd. They are celebrating their 59th anniversary as a hospital and hospital system today. We're about to go inside and hear from some speakers, members of the board, and other important figures from Ozarks Medical Center.
We've gone from an emergency room with one room and a physician on call to 1,000 visits a year to now a 16-bed facility, and we saw for 27,000 people last year. That's 72 people a day that go through our ER. That's an amazing number. Our medical staff has grown from 19 active and associate members in 1968 to 80 today. In 68, the medical staff was made up of family practice physicians and 2 general surgeons. Today, the medical staff includes multiple specialists, including a neurosurgeon and all kinds of a cardiothoracic surgeon as well. Other significant change is technology. We've gone from using typewriters and carbon papers to having computers available to the majority of co-workers. We now have a state-of-the-art patient monitoring equipment and grown from basic x-ray services to providing digital mammography, nuclear medicine, CT, and MRI studies. Amazingly today, OMC has 114 beds and we serve an 8-county area. We employ 1,200 people. And if you think about that, that is a lot of people to employ. We're the biggest, if not one of the biggest economic parts of this city and this whole area, 8-county region. So thank you for being a part of that with us. The future now holds in store for us a new medical office building that will connect this to Shaw. And if you haven't seen the pictures, I highly recommend looking and see what's going to be, because it's going to be one of the most beautiful buildings West Plains has ever had. And we're going to go from a place when people say, well, you're going to the hospital. If you say that right now, a lot of people will ask, what's wrong? We're about keeping you healthy, because we know it's a lot less expensive to keep you healthy than it is to treat you when something's wrong. None of these accomplishments, talking about history, would have been done without the help of our doctors, our staff, our administration, and most of all, nurses. You chose healthcare as a calling because you want to help other people. Every day's taxing. Some days you might see the first breath of a baby being born, and unfortunately some days we're last people, where they have their last breath and we're there with them. We have times when we're in the hospital, that's some of the most trying times of our life. Because of the nurses and the staffs and the doctors we have here, though, it gives people a sense of dignity and makes them feel important, because some people have nobody. It's great when you walk into a hospital room and you see family around, but we have to remember too, there's also those who don't have anybody, and they come to this organization and they're in the toughest and most trying times of their life, and it's our obligation not only to make them better, but to make them feel great as human beings as well. Thank you for the last 59 years and all you've done for OMC, and thank you as a community for being here as well. Appreciate that.
You know, the greatest accomplishment that we can ever achieve is that we made a difference for somebody else. That we're able to serve and be there for somebody in that sacred moment when they need us the most. And Travis and Bob alluded to that at the beginning. But that's really all this is. All this stuff, the buildings and all that stuff are buildings. It's the people and the patients that make a place. You know, this is just bricks and tile and stuff like that. And I'm so very thankful to get to serve alongside all of the people that are here and that work here every day. But I did put together my list for Carol, so I'm going to go through a few of these things. And I didn't get them all, I just picked out some. We continue to expand cancer, our cancer center. We had about a $1.8 million project. We've made a commitment to the continuing legacy of making a difference in the lives of people who happen to have cancer. We built an orthopedic service line, and I was talking to Kim Thompson, the CFO. We did that before we had a physician that we had identified to go into it, because we needed to make a commitment to have good orthopedic surgery right here at home. The creation of the Network Operating Council, which many of you won't even know what that is, but we have a physician leadership group, or a group of physicians that are absolutely committed to the success and growth of OMC and OMC's medical group, which currently has 53 providers. If you think about that, 53 providers in OMC's medical group. Over the last 4 years, we've added 31 physicians. That doesn't include nurse practitioners. There's probably another 15. And we are so blessed to have all of the physicians and the nurse practitioners here with us serving patients. We've had tremendous financial stability, which goes back beyond my time here. It started 59 years ago. There's been ups and downs, but all of that stuff builds up to a place to where you can make it all work. In the last 4 years, we've had an average operating margin of around 4%, which is quite a bit above what most community rural hospitals have. We continue to expand the hospitalist program. We've started a nurse residency program, and many programs we've started with the West Plains School District with the idea that we want to try to keep people here. If they want to stay at home, we want to provide opportunities for people to be able to stay right here. We've initiated 2 significant plans, which includes, and these are just cultural, but a physician satisfaction survey. And what we're after there is we want physicians and providers, nurse practitioners, to feel like they have the very best place to practice. We initiated a coworker engagement survey. Same thing there. We want our coworkers to feel like they have a great place to work. We've been Leapfrog Grade of A, that's a safety survey, 2 times in a row, which is a phenomenal, first time ever in the history of Ozarks Medical Center. We've had exceptional culture of safety service survey results. We've already mentioned the top 100 rural hospitals in America. We've reinvested over $40 million back into the communities that we've served over the last 4 years. And as you can see right here in this space, we're starting to create spaces that reflect the care that is provided here. From open heart, cardiothoracic surgery, interventional cardiology, oncology, medical and radiation oncology, neurosurgery, urology, orthopedic surgery, general surgery, I could go on and on. We're very fortunate that those physicians are here and we're able to provide those services here. We've initiated the largest project in the history of OMC, which is a credit to all of the providers and coworkers that are here. Their continued dedication are the reason we're able to embark on a $45 million expansion project that will serve our community here. The expansion will be over 100,000 square feet and will include physician offices, imaging, gathering spaces, cafeteria, pharmacy, and finally, a new women's center that will welcome new members to our community in a very special way. And like I started with, most important is that we've been a part of patients' lives. That was started 59 years ago with the idea of a neighbor taking care of a neighbor, of doing the absolute best for our community, of going beyond where they even dreamed probably 59 years ago. I hope and I know the leadership of OMC hopes we are living up to the legacy that was created so long ago. Our future is bright, and we only have to dream of what we can achieve together. So thank you very much. And one of the things that makes my job a whole lot easier is we have a group of passionate, dedicated people who have chosen. There's no pay, there's none of that stuff, but the hospital board takes a tremendous amount of personal time for them. If I said 5 hours a month, I would be undercutting it by probably 5 or 10 hours. So somewhere between probably 10 to 15 hours for each one of them. Meetings at night away from their family. But we have an incredible board. Thank them for all of the things that they do for our community every day. So